Mr. Pallone?
Thank you,
You're
Mr.
recognized.
Chairman. I wanted to turn to Ms. Allen. Just last week, President Trump put out his so-called Great American Healthcare Plan, where he says we shouldn't fund ACA enhanced premium tax credits, and we should just give cash to people to put in tax-exempt health savings accounts. So, Ms. Allen, your testimony speaks to the more than $25,000 in out-of-pocket healthcare costs you're facing this year, and that's even with becoming Medicare eligible in September. In the face of losing the ACA enhanced premium tax credits, would having access to a health savings account put a dent in your healthcare costs? Let's even say that the health savings account was preloaded with a couple $1,000s, which seems to be what the president's talking about. How does that compare to the reality of the healthcare costs that you're facing?
Thank you for the question. Frankly, that's insulting. A $2,000 deposit into a health savings account for someone whose premium is $2,000 a month does not go a long way. So wouldn't be very helpful at all.
Yeah, my point is that the president and I think the Republicans are not facing the reality. They have these ideas, which they even, some of them passed on the floor a couple of weeks ago. The president talks about it. But they're not really addressing the root causes of rising health care. And the only people that I know who, talk about this, willing to do a high deductible, we hear like could be $7,000, $8,000 a year, and then, you get a couple thousand in a health savings account, are people that are wealthy. Because you can't, it seems to me you can't, put money into, first of all, you can't even put money in a health savings account unless you have some excess money to spare, right? And so this idea of highlighting the health savings account as an answer, it just isn't. It only benefits the wealthy, in my opinion, because the majority of Americans can't afford, their medical bills, much less pre-fund a tax advantage account for thousands of dollars. It doesn't do anything for them. And I really think that if we want to address the affordability crisis now, the only answer is extending the ACA enhanced premium tax credits. But let me go back to, I don't know if we have time for everyone, but I wanted to ask some of the CEOs. I'll start, I guess, with Mr. Markovich, where to the companies who provide coverage on the ACA marketplace and ask for the plans you offer. What are people telling you about the coverage? What are you hearing from them? I'll start with you, Mr. Markovich.
Well, what we're seeing is that for certain people in certain categories, their premiums are going up quite substantially as a result of the expiration of the tax credits. I was speaking to a member in California last week. He's 61 years old. He's the proprietor of a small business. He's been a 10-year member under the ACA, covering himself, his wife, and his 2 daughters. And his premiums were going to go from $1,600 a month to almost $5,000 a month. He simply couldn't afford it, and he ultimately ended up putting his wife and 2 daughters on a bronze plan, a much less rich plan, and he's literally going uncovered and just trying to hang on until he's eligible for Medicare. So for people in that category, higher income, 400% of the poverty level, and that age bracket, it's been some significant increases.
And the same thing is happening in my home state, right? In other words, you have people whose premiums have doubled, tripled because of the Republicans' inaction on the premium tax credits. And the problem is if you go from silver to bronze, you often have less coverage, or you have a higher deductible or higher co-pays. And, I just, when the Republicans say, oh, that's okay, it just doesn't work for the average person. And the idea of having these health savings accounts to make up the difference is completely out of reach for people who are middle income. That's my experience. So I know I can't go down the whole list here. My time has run out. Thank you, Mr. Chairman.
Gentleman yields back. Now recognize the gentlelady, Vice Chair of the